as we often hear, Texas does have the worst uninsured rate in the country. Our overall uninsured rate is at about 25% of all Texans, or 1 out of every 4 Texans lacks health insurance. But it's almost 1 in 3 Texas adults, working age adults between 19 and 65, 30% are uninsured in Texas.
Well, I think the number of patients needing assistance and care continues to grow, and so we're able to take care of a certain number of them here, but there are many more that we can't and don't take care of. So that's one thing that is a frustration for us, is not being able to help more folks. And we certainly look for ways to be able to do that and expand what we're doing. The other thing, though, is that as this becomes more and more of a problem and a large number of people are uninsured, the burdens on all of the sort of Band-Aids that have been put in place to help care for the uninsured are less and less effective. So, it used to be some time ago you could count on physicians to be able to take care of a certain number of patients who weren't able to pay or weren't able to pay very much in their private offices. And increasingly, as medicine has become more of a business and more driven by how much insurance companies are able and willing to reimburse, those pressures on physicians lead to them being able to do less in terms of taking care of folks who are uninsured. That then leaves fewer options for those people, and so they wind up looking for care elsewhere.
The reason this issue has taken on such prominence and is so much more alive in the political debates in the election season, for example, really is the fact that it's more and more affecting folks, well up into middle incomes. And so, for example, of our uninsured adults in Texas, 43% of them are actually above 2 times the poverty line. That shows you that, really, slightly, almost half of our uninsured are not just above poverty, but above twice the poverty line. They are well into the middle class. And that really changes, the politics of the issue.
When I lost my job in 2003, I had no access to health care. So I couldn't maintain the medications I needed. And since I support myself, I don't have any other means of support. And with the huge stress of no money and just feeling like any time I'd lose my home, basically, and having to declare bankruptcy and going down so many blind alleys trying to access health care and just get the medications I needed, my health just sort of spiraled down into a pit, which culminated in cancer, major depressive disorder and cancer. But you still expect that you're going to have a decent life. You don't think that you're going to work so hard and get a master's degree and work so hard and win awards for your work, and then just wind up thrown into the gutter like a piece of trash that's not worth anything. That's not worth being able to go to the doctor for a doctor visit. It hurts. You just say, I don't deserve this. Well, nobody deserves it. But then you think, I've done everything I was supposed to do. I did nothing to supposedly bring this upon myself.
Part of what we're looking for in terms of health reform is something that kind of makes up for that sense of injustice that folks have, that I'm doing everything right. I'm working full-time. Maybe my husband and I are both working full-time, and we don't have coverage through our jobs. We don't have coverage for our kids, those sorts of things. There is just a very, very big disconnect between it's no longer by any means a guarantee that working full-time will get you access to health care.